times get hard, and we're here to help at NorthPoint.
Hello, welcome to another episode of NorthPoint's Making Health Happen. My name is Lisa Castile, your host for the program. Thank you so much for tuning in today. This series is being brought to you by NorthPoint Health and Wellness Center. We want to connect you with topics in health and wellness that impact our community, and we want to provide you with practical tips and resources you can use. Today, we will be discussing the importance of maintaining dental hygiene with Dr. Michael A. Brooks, Jr., DDS, who is the dental director here at NorthPoint Health and Wellness. Welcome, Dr. Brooks.
Welcome, everyone, and those of you listening into the show today.
All right. So, Dr. Brooks, you have a very important job here at NorthPoint. You oversee our daily operations, ensuring compliance and regulations, maintaining patient safety and satisfaction, managing all financial responsibilities, and implementing best practices in oral health care. That's a lot. That's a big list. Right?
Yes, ma'am.
Yeah, you also contribute to education because you are an adjunct professor in the Division of Outreach at the University of Minnesota School of Dentistry. So you share your clinical experience and expertise with dental students, right?
On a daily basis, we try our best to work with them, and I have the privilege of working with the students primarily on Wednesdays, and then I also fill in with other staff on vacation.
Okay. All right. Well, we know that throughout your career, you have been recognized for your leadership and dedication to community service. You've received the 2019 Distinguished Alumni Award from Concordia University in St. Paul. In 2021, you were named Top 40 Under 40 Dentist in the USA by Incisal Edge. Is that right? Am I saying that right?
That's
Incisal?
correct.
Okay, Edge Magazine. And then in 2023, the 40 Under 40 Award from Minneapolis St. Paul Business Journal.
Yes, ma'am.
All right. Any other accolades we need to be aware of about you, Dr. Brooks?
Well, there's a number of them that come, but, that's the three that we like to discuss, the most current things. But the biggest award I have is, my wife and my kids.
Yes, and I was just going to mention that when you're not working and serving in the community, that you enjoy creating cherished family memories with your wife Jessica and your two daughters Mariah and Malia. All right. Well, thank you again for being on the program today. We are going to get started right away with these questions. You ready?
I'm ready.
Okay. All right. So what I want to hear from you, Dr. Brooks, is how did you get into dentistry? Why dentistry? Most little kids don't like going to the dentist.
Yep, a lot of little kids, no.
Yeah.
So I have quite the story. And so my mother probably cringes when I tell this story, but when I was younger, I had a high affinity for a young lady. Okay. And her grandmother was the local neighborhood snack lady. She served Lily Dillies. You go get you some popcorn, some kettle corn. You go over there and purchase them from her in the projects. And so I came home and I told my mother, I said, hey, I was talking with Brandy today and she got a toothache. And I'm just puzzled. And my mom's initial response was, what did I tell you about that little girl? And I was like, no, wait, I got a real question. It doesn't really have to deal with her. It's about the situation. And she was like, okay, what's the situation? I said, she told me she had a toothache. She was in a lot of pain. Me being smart, I just asked her, do you have insurance? And she said, yes. So then I was puzzled, trying to figure out, how do you have a toothache, have insurance, but you won't go see the dentist? And it was at that moment that my mother explained to me that you've had the blessing of growing up with your father being a military service officer, and you have TRICARE. You take that card, and no matter whether you need to go see a physician, a dentist, a behavioral health specialist, a neurologist, ophthalmologist, and it affords you the opportunity to see all these folks. Okay. Most of the people in the community where I grew up at Bahama Village, they had to choose between paying dental premiums and putting food on the table. So what people did is they brought $5 toothpaste, $5 toothbrush, and they prayed nothing happened. So that was my initial inkling into the disparities of dentistry and understanding that there was such a need, even in so many different varieties of folks. It didn't matter. A lot of times we look at dentistry and you say, it's underserved people that have the most disparities. And it's actually a widespread thing because historically, dentistry was looked at as a luxury. Only
Okay.
rich white people really receive dental treatment. Going back to President George Washington, his big thing, and everybody knew his status, was his dentures. He had ivory teeth, so that was a status thing. But as we grew in our understanding of holistic care and systemic impacts and connected them out to the body, everyone realized how important having good oral health was, and that it should just be a standard for everyone to receive that treatment.
Okay, standard of care. Wow, wonderful. Now, how old were you when you came to this realization and started putting
I was
two and two
11.
together? 11 years
11
old.
years old.
Okay, so you were ahead of your time. Because
little
most
bit.
11-year-olds wouldn't think about that, right? And think about the impact it was having on community.
Correct.
Yes. Okay. All right. What is daily dental hygiene? Why is daily dental hygiene important for one's overall health?
A lot of times we start with a fundamental conversation and get folks to understand that almost everything you put inside of your body goes through your mouth. Whether you're taking your medication, whether you're eating food, drinking water, enjoying a nice cold ice cream on a hot day like we're going to have this weekend, it all goes through your mouth. So maintaining your oral health is going to be the leading force in maintaining overall health. And it tends to show a lot of clinical signs sometimes that allow people to understand that certain things are occurring, and we get them over to our physician partners or in medical.
Well, you've talked about already some of the common barriers that we see in underserved populations. What do we do here at NorthPoint to eliminate those barriers, Dr. Brooke?
At NorthPoint, we do a good job of truly trying to meet folks where they're at. Dr. Thomas does a great job of talking about this, and Dr. Gillen when we talk about our smoking cessation program, and the readiness of someone being willing to quit smoking. But I like to channel that when we talk about dentistry as well. If I get someone in the chair and we're talking about oral hygiene habits, and you got to brush twice a day and you got to floss, and they only been brushing once a week and they haven't flossed their whole life and they 50 years old, there's no magic button I can press, no magic wand I can wave that they're just going to leave the office and that next day they're going to be brushing twice a day and flossing. So we meet them where they're at, and we try to get them to grow and utilize the tools that they have. With our teenager population, if they have a smartphone device, I tell them to put an alarm in your phone. What time do you typically go to bed? And they're like, 9:30, maybe 10, depending on what's going on. I say, okay, let's put an alarm in your phone for Monday, Wednesday, and Friday. That at 9 o'clock it goes off and it tells you go floss. And that's how you start it. So if you start doing it every other day, 3 times a week, and then we get up to 4 times a week, next thing you know, it becomes a routine and it's something you do on a daily. But it's also having access to the tools. There's been times where folks have told me, like, I don't have floss. And so I say, do you know they sell floss at the dollar store? And they say, no, I didn't know that. And then the next thing you know, it's trying to find ways to make the tools and the instruments at an accessible level.
Sure.
Now,
Eliminating those barriers.
Correct.
All right. Wow. That's really cool. So then education is a big piece of this. You go into the community, you educate young people, you have patients that come into NorthPoint, you're educating them. Would you say that is a significant part of what you do, is the education component?
I would say the education piece is fundamental. And that's where, when we see it both directions, where we're working with guests or we're also working with the students. It's truly taking that utilizing it as a vehicle to get you to that next level. The old saying goes, and for those folks listening in, you probably heard your grandmama say this, auntie, maybe even grandpa, uncle. When you know better, you do better. But we have to start with the baseline of understanding what people truly do know and getting them to a place of comfort so that they can be vulnerable and tell you at 65 years old, I really don't know how to brush my teeth properly.
Right.
Or flossing, like, what is the importance of flossing? But when you build those relationships and have that rapport, then you can have those deeper conversations and truly lead to life-changing habits.
Okay. That's deep. That's that cultural responsiveness that we try to cultivate here,
Yes.
right? Yeah. So tell us a little bit about your staff. How many people work at NorthPoint? Dental hygienists?
So within NorthPoint, we have a team total of 50 people in the dental area. That also encompasses our satellite clinic at 800 West Broadway and includes our community health worker. The collective of the team allows us to do the magical work that we do here, from the guest services at the front, being that initial interaction, getting folks scheduled, welcoming them in when they show up for their appointment, to our care coordinators helping facilitate on the back end, prioritizations, getting the sliding fee schedules established, to the actual team that's in the clinic day in, day out, side by side doing the work. Our hygienists, we're very fortunate to have hygienists and to have the caliber hygienists that we have as well. We provide a lot of advanced restorative treatment to guests, and that's the biggest thing that sets us apart from a lot of the federally qualified healthcare centers, is the level of care we provide. And we do it with a smile, and we do it with a very broad staff. Currently in the dental department, we range, it fluctuates day in and day out depending on which members of the team are here, but we have 9 different languages that are represented. So when it comes to having someone that may have the cultural understanding, the linguistic ability to communicate with this individual and reach them on a deeper level, we have that. And that what really makes us unique and sets us apart.
Amazing. Wonderful. Let's talk about your leadership style a little bit, because you are a very dynamic leader. I would use that word for you. You're dynamic. You have to keep your team motivated. How do you motivate your team?
I think the biggest motivation for us when we really sit down and have those true conversations is the guests that we serve. You have to come with a servant leadership mentality to truly do this work and enjoy it. If not, you'll be overwhelmed. You'll be facing burnout. As I say, the pandemic has taught us burnt up, because that's a whole nother level of exhaustion that you will deal with. But when you understand that you're literally one heartbeat away, one footstep away of being in a very similar situation as the guests that we serve, you become grateful for the position that you are in, and you do your best to provide the highest level of care with the deepest level of empathy and compassion to our guests.
I love that. I love that. Servant leadership. So let's talk a little bit about you. So I want to ask you some practical questions now for the folks that are listening to the program. So how often should people visit the dentist for checkups and cleanings?
Typically, every 6 months.
Okay.
That's a recommendation. Once you actually get in and you begin to have a periodontal plan put together, or a hygiene treatment plan put together for you, you start to understand, do you need more frequent recalls, or are you good at staying at this every 6 months, or do you need more invasive treatment? Do you need scaling and root planing because you have advanced bone loss and gum tissue disease? And those are the things that we talk about, is the routine pattern of going. But the one thing I want to really hit on and touch base with this audience is, when does that begin?
Yes, when does it begin?
If you ask the average person, most people are going to say 4, 5 years old. But do you even know where that kind of stems from?
No.
You have to have a dental examination before you begin kindergarten, but then after that, it's not a part of annual physicals.
Okay.
Now, depending on what type of insurance plan you have, they'll promote it. They'll do certain incentives to get you to go. But it's that aspect of getting folks in. A lot of people don't even realize that basic dental preventative is covered by a lot of medical insurance plans too. Depending on what plan you have, they'll cover you getting your exam, getting your radiographs, getting your cleaning every 6 months. But you have to understand what coverages you have based upon your medical insurance and utilize them to your full potential.
Okay.
I would recommend, and this is going out to, I would say, parents with young kids, expecting mothers, fathers, understand this. As early as 6 months, kids typically get teeth. So if you don't bring them in until they're 4 or 5 years old, you literally, I'm going to use just a new catchphrase, you've had watchful neglect for 3.5 to 4 years.
Wow. Okay.
And it's sometimes things that could be prevented. Everything is not going to be preventable, but with the engagement, preventative treatments, and the education of how to do the home care, a lot of things can be stopped or be kept to a minimal level. Okay. And I like to tell guests all the time, what we do here in the clinic is only 5% of the impact on your oral health. The other 95% is what you choose to do and choose not to do at home. But if we equip you properly to understand what it is you need to do at home, how to do it, but most importantly, why you should do it, then we see the end results.
Okay. Now let's talk a little bit about that, because I know we have some initiatives and programs here at NorthPoint to, as you said, connect with people where they are out in the community, our community engagement efforts, and you spearhead some of those efforts. So let's talk a little bit about that.
Right. So just as some small examples, we do a partnership with Independent Health, our back to school program. That has really become a big thing. The kids come in, they're able to get their annual physicals, and they also get their dental examinations, and Hennepin Health provides them with some incentives, backpacks and things of that nature.
Okay.
The kids love it, the families love it, because it allows mom or dad to bring them in. And if you have multiple kids, you only taking one day off from work to get it all addressed.
Sure.
Versus you have 4 or 5 kids, sometimes it's tough to get all 4 or 5 in, especially in both disciplines in the same day.
Right.
Then we look at our community outreach engagement, as we say, our coach program. Community outreach providing access to community health care.
Okay.
We truly go into the schools and walk alongside the professionals in the school to partner with them, whether it be a parent liaison. Some schools are blessed and fortunate to have a school nurse. We work with them. We come in, we do screenings in conjunction with our human services, our community health workers, and we look at not just oral health, but it's hearing, vision, BMI, getting kids to understand that all of these things impact your ability to learn. In 2023 is the last time we looked at the statistics. It was 54 million hours of school that was missed. And this is 5th grade and under due to dental pain.
Really?
So when you think about that, 54 million hours of school was missed due to that. So as we start to educate more people and encourage more folks to start bringing them babies in at 6 months to get that first checkup, and then you're coming in every 6 months, those are hours that can be given back into the educational process and further hopefully work to close this disparity gap that we face here in Minnesota.
Sure. Wonderful. And you've won some awards for the work that you've done for Give Kids a Smile, right? Can you talk about that a little bit?
Yeah, so we've been very fortunate to have the continued success with the Give Kids a Smile program. A lot of places are still trying to do it, and there are certain barriers that come up, but we appreciate that NorthPoint, in conjunction with Hennepin County, through support, we're able to offer this once a year event to those that are the most in need. And when you think about preventative treatment, that has a cost, but when you talk about restorative and advanced restorative treatment, sometimes that is financially out of reach for some people.
Yes.
You're talking about $1,500 for a root canal, they're like, that's the rent.
Right.
And then you need 2 of them, that's 2 months worth of rent. I think we're going to have to pull those teeth.
Yeah.
So on that Friday and Saturday, when we hold that event and we're able to do some of that advanced restorative treatment and allow some of these kids to get care that their parents have not the ability to give them, that's the biggest reward for us. And then what we've seen over the past couple years, typically they come in for Give Kids a Smile, and that's the only time you see them. But we've seen more and more parents actually get engaged and involved in the process. And yeah, they come for Give Kids a Smile to take care of some of the bigger things, but then they return to take care of the smaller things and then become a routine patient and stay within that 6-month recall. And that's the biggest thing. It's not just changing your response in urgent situations, because if your child has been up for 3-4 nights complaining of pain and you done took them to the ER and it seems like that didn't help, you're going to respond. You're going to try to find some way to do something. But how do we get you to just make it a part of your normal routine in life, to where you're like, okay, I need to carve out these couple hours every 6 months, get you in there, get a checkup, make sure everything's going good. And if we have any little issues, we want to address them while they're small before they become big, and we end up with the end result of removing your teeth.
Yeah, we don't want to go that route. So I want to ask you too about, if you're somebody that's listening and you have some reservations about going to the dentist, right? Because there's been negative connotations with going to see the dentist, can be painful. What would you say to our listeners?
I always tell people, even when I get guests in the chair, I mean, if I had $1 for every person that told me this, I could go have lunch at folk with their child. I hate the dentist. I say, that's fine. And they look at me awkward. And I say, that's cool. I don't want you to like the dentist. I want you to just like Michael.
Nice.
And they laugh. But it's bringing down that barrier of historical trauma. I mean, there have been things that have occurred in folks' lives that we have to start to deal with and unpack.
Mm-hmm.
And fortunately, through some of the training we receive here in Hennepin County, as well as live life experience, you understand how to engage in that conversation and properly work through that with that individual. I mean, I've had guests that tell me, there's no way you're going to be able to do any treatment on me unless I go to sleep.
Wow. Because they're that fearful.
They're that fearful of receiving the care. And so I say, okay, well, let's see what we can do. We have some nitrous here. I can't necessarily put you to sleep, but I can put you in a place of comfort, reduce some of that anxiety. And then when it's all over and done with, they're like, I did that.
Right.
And that's the moment of the self-recollection of, I can do this. It is possible.
Sure.
But you have to be willing to walk with them along that journey. Versus if they come in and they hit you with that, I hate the dentist. You're not going to be able to do anything to me. And you meet them with the similar energy of like, okay, I agree with you. Well, let me give you a prescription and then we'll get you on your way and see if you come back. We'll schedule an appointment for 3 weeks out. That person's probably not going to come back. The antibiotic is going to work for about 4 weeks. And then after that, then they're going to be in pain again and they're going to seek care, maybe returning here or somewhere else.
Okay.
But it's taking that moment to truly sit down and engage with someone and say, hey, I want to understand why you feel like that. And then when they tell you why, don't be defensive or dismissive. A lot of times, as a professional, we want to hold up the professional guard with dentists. No. People make mistakes. Things happen.
Sure.
But
you don't
it's
want to feel judged when you come here.
You don't want to have people feeling like, oh, well, you looking at my mouth and you thinking about, well, how do I live? What have I done? What do I value? What do I not value? That when you having trouble trying to figure out where you're going to live or how your next meal is going to come, I highly doubt you're worried about making sure you got some Listerine to swoosh after you brush and floss.
Sure.
So it's how do we give people the true dignity that everyone deserves, no matter how they show up. And that's another barrier that we deal with a lot of times. In healthcare, we have all these expectations and anticipations. But when someone shows up and they don't necessarily operate or maneuver how we feel they should, that's the moment where you can have the biggest growth opportunity, because it's life-changing things. As I tell the team all the time when they say, oh, I don't feel comfortable when they're cussing at me. That's okay. I understand that. I respect that. But let me give you another spin on that. It's a coin, right? It got two sides to it. You looking at the head, let me give you the tail. Individuals are going to respond two ways in moments of adversity. How they have responded in the past, or how they have seen people that they love and care for respond in similar situations. It takes you stepping outside of your comfort zone and being comfortable being uncomfortable and being the professional and walking them through the process of, okay, this is what you need, this is how you need it. Now, once you establish that relationship and we have a little bit of rapport, then you can say, okay, the way in which you shared the information with me was a little bit off-putting for me.
Sure.
If you could bring it down a little bit, or maybe the profanity, that's a little bit too much for me, then you can have that type of conversation.
After you establish the
have
rapport
established
and the
rapport.
trust and the respect.
That's it.
Yes.
But when you lead with that, you dismiss any opportunity to create a genuine connection. I call it the R&R.
The R&R.
It's not rest and relaxation. I know that's what we all need right now.
Okay.
But it's rapport and respect.
Nice.
If you demand respect because of the letters in front or behind your name, you'll never have genuine rapport. But if you build rapport, you will gain unimaginable respect.
Brilliant.
And
Look
that's
at
the
you.
key.
That's your leadership right there. That's some wise wisdom.
I try.
Wise words.
I grew up around some wise older folks, and I listened in.
The old people.
That's the key.
All right. Well, we're wrapping things up. If you could give some advice on maybe 3 things, just small steps that someone could do in their daily dental hygiene routine, what would those 3 things be?
So I would say make sure that we utilize a extra soft toothbrush.
Okay.
A lot of times we brush hard, but it damages the soft tissues that protect and surround your teeth, and then you lead to having recession and bone loss because you have excessive forces. I like to coin it as, when you brush your teeth, it's like bathing a baby. If your baby was to slip and fall down in a muddy puddle, are you going to get a Brillo pad to make sure they're clean? No, you're going to continue to wipe soft, and you'll just wipe longer. So if you eat some sticky stuff, you know, it's summertime. We going to the cookouts.
Yeah.
So maybe we get off in a little peach cobbler.
Right.
Just brush your teeth a little bit longer, not necessarily harder. Then there's the flossing.
Okay.
The reason we promote flossing so much, you see all these commercials and folks are like, what does it really do? It's a piece of string. Well, the reality of it is when you brush your teeth, you only clean about 66% of the tooth surface. The other 34% is between and underneath the gum line. And that's where adequate brushing techniques and flossing helps maintain that you're cleaning 100% of the possible tooth structure. And then last, but definitely not least, for folks struggling with dry mouth and other things, the adjunctive tools. So using lozenges, mouth rinses, all of those things are helpful, but we have to establish the foundation first with the baseline of adequate brushing and having daily flossing.
Excellent. All right, Dr. Brooks, thank you so much for being here. Thank you for your leadership in our community. Thank you for, just looking at individuals and meeting them where they are, and taking that integrated approach to holistic care. So thank you, sir.
I just thank everyone that's listening and anyone that it moves on their heart to maybe ask additional questions to their healthcare providers or to seek out a healthcare provider.
Thank you for listening to this week's Making Health Happen. We want you to know that we're here to partner with you and to help make health happen in your life. To learn more about NorthPoint, call us at 612-543-2500 or visit us on the web at northpointhealth.org.